There are many different types of facelifts, and it can be very confusing as to which one might be best for any given person. Or are you, in fact, a candidate for facelift yourself? So let's talk about the different types of facelifts. We can divide them broadly into two categories: mini facelifts and then perhaps maxi facelifts. Now, mini facelifts include those procedures which primarily have a very small incision made just in front of the ear. And they're used if one just wishes to lift the jowls a little bit or the cheek. And we can get some improvement in the neck. So for a person who's younger and doesn't have very much sagging tissue in the neck or in the face, then they could be a good candidate for one of those mini lifts. Some of the modifications of those mini lifts include what's called the max lift, in which a couple of sutures are placed in order to lift the cheek. And that can be helpful as well. On the other hand, if your signs of aging are a little bit more, you've got a little bit more sagging in the lower face, a little bit of sagging in the cheek, and perhaps more sagging in the neck itself, then you may be a candidate for a lift which is just a little bit more than that. And in these situations, usually what we do is make a very fine incision just behind the ear and down into the hairline. And we do that because we can then get a better lift of the neck and usually a greater lift in the cheek and in the facial area. And so what we do is look at you, our patient, and say, what is your concern? How severe are the signs of aging? And what will work best for you? So we've developed a facelift, which I call the graduated facelift technique. And in fact, I've taught this technique all over the world. And so what we do is combine the best of all of these lifts. It's not all one or all the other. But we create our facelift technique such that we start with what you might call a mini lift, and then I can tailor that lift for any given patient to do just the amount of lift that they need. Anything from a mini lift right through to the so-called deep plane facelift, which truly gives us the best results, if indeed that's what you need. So by performing a graduated facelift, it's a little bit like turning a rheostat up on a light switch. We can do as much as you need, but no more to get you a very satisfying result. And we have many, many patients who come back and see us, and when we look at their jaw lines, their neck and their cheek, and we look at their photographs, we can see that even 10, 12, and sometimes more years after their surgery, they still have an improved appearance over what they had before. So come and speak with us, and we can help you determine which facelift technique might be best for you.